And I'm actually not going to do a PowerPoint presentation. I am just going to speak about it a bit, simply because there was a number of questions that was presented to the OHT, and as has been set up with the conversations and slide decks presentations from the other presenters, there are actually lots of challenges in the direction where we are headed right now, and I don't actually have a lot of answers from the OHT, but the most important thing for that is that there are some of the partners who are around the table as part of this group who are also part of the OHT ESO, and want to carry on the dialogue about how we advance it forward. So one of the first question was, what is the overall provincial plan on healthcare recovery? And excellent question. That's being directed by the province and Ontario Health, and they are managing that healthcare recovery planning. And as of yet, there has been no direct engagement on OHTs across the province in that effort as of yet. I will say that at our OHT discussion, part of the conversation is absolutely knowing that for immigrant and racialized populations, as we've been discussing today, the pandemic isn't over. They're still experiencing the disproportionate impact of all of infections and of the policy and of lack of resources. And so we're continuing to say that whenever we have the opportunity to do that. But the provincial plan has not been communicated to us as OHTs, and they have not significantly engaged us in that. In terms of what's being planned to improve access to healthcare for immigrants and racialized populations, again, it wasn't clear or not whether this was a call to the province or for the OHTSO. So for us, we recognize that this is an important part of the discussion going forward. We recognized, as Hindia has highlighted, the lack of primary care is a significant barrier, and it's also been a significant barrier about Ontario Health not having a plan to increase the number of healthcare providers. And so we are going to have to figure out what that planning is. And so we have a primary care providers table that does have some discussions around the system for healthcare for access to primary care planning. And so I've made a notation of that to bring that back to the lead on that. The lead for that is Kelly Toner at Southeast Ottawa CHC. So I will bring that piece of feedback back to her. But provincially, again, Ontario Health has not yet communicated or engaged us in that discussion. As the next question was, do we have data on the current gaps in immigrants' access to healthcare? So from the data packages from the Ministry of Health, none of immigration data is provided to us in terms of newcomer status. So the only thing that we have within our OHT from a data perspective is what partner agencies have been collecting and what they've been willing to share. And I think, Hindia has and colleagues from public health is why this is really important, and that importance of getting data and that being able to desegregate that sociodemographic data is critical. But data collection in this regard is really inconsistent across the system. It's not actually mandated within the data collection systems. And that does mean that within the existing systems that people have, if it's not a standardized collection data item in whatever system they're using from their electronic medical record or electronic health record as a whole within the system, that's all that we've got. And so are continuing to push on this, and improving our ability to collect and use that data is one of the priorities in our digital strategy and data strategy for the OHT. So we're not there yet, but it is designated as a critical priority. And so the next question is about what is the Ottawa Health Team Équipe Santé Ottawa planning to improve the healthcare access of immigrants and racialized populations. So we as an OHT are continuing to have those partner conversations and refine our priorities for this coming fiscal year beginning in April. And so we can share that back. That conversation is happening now. But we do have, as was pointed out by Hindia, a commitment to ensuring that health equity considerations are front and center in all of the work that we take on. Has been highlighted several times. Our frustration, even coming from the Ministry of Health and other funders, that trying to get that sustainable funding for population-specific initiatives, for example, immigrants and racialized populations, has been incredibly problematic. And Nani and I've talked about this a couple of times in the past 2 weeks, is that initiatives such as Counseling Connect have prioritized that provision of services in multiple languages and by and for counseling for the Black community as examples. But there hasn't been a sustainable funding that we've been able to pull together to do that. That's been really critical, especially when we've been looking at the interplay between the pandemic and then the recent occupation of Ottawa, and all of the racism, anti-Semitism, Islamophobia, transphobia, homophobia, misogyny that was playing out directly embedded as part of that occupation. And so we're continuing to work on getting some of that funding stabilized, because as I think it was Sophia who said, is you can't start and then, communities are like, I don't know that you're going to be there. Why would I invest my trust in something that's not going to be there? So we are working on some of those sustainable strategies. With regards to that collectively advocacy with regards to the province to ensure that improved healthcare access for immigrants and racialized populations, these conversations are really critical. The strategies that you mapped out, Hindia, I'm looking forward to getting that slide deck and taking it back to the OHT collaborative leadership table, because I think we need to structure that and continue to work on some of those pieces. In the very short term, I know Kelly has been doing some work and Kelly Toner from Southeast Ottawa CHC has really been continuing to stress the importance of continuing to fund what they're calling the high priority neighborhoods, but those neighborhoods where there are increased racialized and immigrant communities, higher rates of infection, lower rates of immunization, for all the reasons that have been highlighted, and continuing to keep the funding and support for that work, because it is not done yet and requires that individualized approach that we've spoken about so many times. So I'll end it there because I know we're at time, and I'm looking forward to the discussion and dialogue.